Hello, everyone. Thank you so much for joining us today. My name is Jana Bitten. I'm the Executive Director for the Oregon Center for Nursing. As everybody is starting to join into the call today, I just wanted to first say thank you, everyone, for taking some time to be here today to hear kind of what some of the challenges that we're facing in the state of Oregon and, quite frankly, across the United States when it's related to some nursing workforce issues. And also just what's been happening with COVID and honestly with everything else. We're really hoping that today is going to be an opportunity for you to hear what are some of the issues that we have been uncovering over the last year and a half that are related to the nursing workforce, not just with clinical placements and preceptors, but some other things, including trouble getting your NCLEX tests and some other things that have just kind of come up in the year of the weird that we have all been kind of living through. So thank you so much for joining us. We are going to be recording this, and you probably already got that message. If you do not want to be recorded, you might want to jump off now, and then you can watch the discussion later. If you have any questions as we go along, this is going to be a kind of an informal conversation. So there are people here in the audience that are from nursing education. There are people from nursing regulation from the State Board of Nursing. And there are people who are here from different employers who can kind of answer some questions if you have any about the experience that you're having with your education this year, and also as a way to connect you with some of the conversations that are happening. So again, thanks everybody for joining us today. I wanted to start out first by just letting you know a little bit about the Oregon Center for Nursing, because it's really likely that you may not have heard of us before. So in the state of Oregon, there is a nonprofit organization, and that is us, that really takes a look at what the nursing workforce issues are in the state. We do a lot of data analysis. We try to figure out how many nurses are in the state, how many nurses do we think that we need, and how many nurses are in education programs right now, so we can always make sure that every Oregonian has access to a really highly qualified, very professional nurse when they need it. And that's going to be all of you. So one of the things that we really have been doing is we also try to convene organizations from all over the hold on just a second. We try to convene organizations from all over the state and different stakeholders from all over the state to really make sure that we are addressing the workforce issues that are coming up. So since the beginning of the pandemic, these are some of the things that we have found. So you probably have all experienced this. And one thing that's going to be really interesting to watch is that this graduating class has probably been impacted by the pandemic in ways that even the graduating class of 2020 did not experience. So we watched as there was an immediate switch to online classes. There was insecurity about whether or not you were going to be able to get your clinical placements. We saw this increased use of simulation. We saw some backlogs for NCLEX testing. Many programs did a delay of the new grad residency programs. There's just loads and loads and loads of ambiguity. So for the people on the call, would you say that's pretty consistent with what your experience was at the beginning? I'm seeing some nods, so which is totally fine. I'm going to pull up the chat really quick. All right. This is kind of where we are now. And this is one of the things that we have been seeing now. We are seeing a huge increase of nurses that are retiring. We are seeing nurses who had initially planned on retiring about 2 to 5 years in the future, and they are noping out right now. The pandemic has been extremely hard on nurses, especially the ones that were working in acute care. And honestly, it's also been hard on nursing educators trying to do all of the switching and all of the constant shifting of the different models. It's been really hard. So a lot of people are retiring. There are staff that are burned out mentally, emotionally, and physically. I do not know. How long have I been muted? Not that long? I touched nothing. Seconds. I swear to you, I touched nothing. Okay, let's go back to this. Increased rate of nurses retiring, burned out staff, And because those staff are burned out, and because we have this increased rate of retiring nurses, there's not as many preceptors. So you will find situations where you might have been promised, or you might have had this idea that you're going to have a precepted position, but they didn't actually have a preceptor because they've just been trying to get people in the right place at the right time. Try as we might, we do not have 100% testing capacity at in our NCLEX, for our NCLEX, and that is not because of anything that the school is doing. That is not anything the Board of Nursing is doing. That has to do with the restrictions that the governor has put on about capacity in buildings until we can get to 70% vaccination rates. And Ruby Jason, who's with the executive director of the Board of Nursing, will tell us again. She asked again, and we still got to know. So that means that people might have to leave the state to get their tests. And we still have some uncertainty about regulations, about lifting emergency orders, when any of that is going to happen. So since we only have Ruby for a little bit of the time, I kind of wanted to check in with you first. Ruby, can you kind of talk a little bit about the NCLEX not going at 100% capacity and what that means for if a student needs to go out of state, for example, and take the NCLEX?
Right. So this is a problem. Again, we asked in the beginning of the pandemic, when the test vendor, Pearson VUE, did a lot of reorganization of their buildings to put up barriers and social distancing and all of that. And we asked the governor at that point, and the answer, well, not the governor, her staff, her healthcare policy advisors. And the answer was no, because of Oregon's stand on COVID. So recently we asked again, it was last week, we asked again. I had a lot of support from the educators. Thank you for all of those who wrote into the governor's policy office. And again, the answer was no. We are at 68.5%. And we're supposed to be at 70%. So that means that there are less slots available in Oregon for you to get an appointment to take your NCLEX. You can take your NCLEX in any state you want, actually in any foreign country you want that is offering the NCLEX. The Philippines actually went to 75% capacity, and we're only like at 50% capacity. But anyway, if you want to go to the Philippines, you can do that. But it has to be the English language NCLEX. When you register for the NCLEX, what you need to do is you need to tell them what state you want those scores to go to. You can only do one state at a time. You can't, send your scores to 10 different states and see which one licenses you first. So if you want to practice in Oregon, you have to let when you register for the NCLEX, you have to let them know that you want the score sent to Oregon. We have extended the authorization to test to 180 days. I misspoke the other day when I said the original was 120 days, but it's not, it's 90 days. So we've actually doubled the amount of time you have to get an appointment, but that still doesn't help you if you need to start a job right away. And yes, who can we, there's a question there. Kelly, can you read that for me? Since we cannot register to take the NCLEX until we graduate. Can't read that.
Since we cannot contact about NCLEX testing capacity and if we need to plan on taking it out of state. And typically, will we be able to register for a testing date as soon as we graduate?
You can register for a testing date as soon as the board releases you. So you have to fill out an application. Your school has to verify that you've graduated. The application has to be complete and the payment has to be complete. And once that gets done, the technician will release you to test. So they'll send a notice to NCLEX testing saying that you are released. You can register with NCLEX now. You can register with NCLEX, and when you have been given the authorization to test, the ATT, you have 180 days to get an appointment, and you will get an appointment probably in 180 days. Yeah. All states, except for 4, are at 100% capacity, and that is Washington, Oregon, New York, and New Jersey. So if you want to go down to California, they actually have extra testing sites because they have millions of nurses. So California might be a good bet. Nevada might be a good bet. Idaho, those places might be a good bet for you to go and register there. But the registration process is the same. You still have to be released to test by the state that you want those scores sent to. So you put in an application with us, your school verifies that you've graduated, and you can go ahead and take the test. You can go ahead and take the test, but even if you take the test and pass it, unless your fingerprints are back, unless you've passed all of the other requirements that the board has about licensure, you can't be issued a license. So just passing the test is not going to guarantee you a license. Still have some other things to do, but it is the biggest holdup, is trying to get that test. So I would advise you to register for the NCLEX, and as soon as you get your stuff in, the technician can release you, and then you can start looking for an appointment. And I would look for an appointment, even if it's a few months out. I would review the test site every single day, because appointments get canceled, and you can always cancel the one that you had and get a new one, but don't cancel the one you had until you get a new one, because it might push you back even further.
Exactly. Yeah. Okay. And it looks like Helena has her hand up. Can we unmute Helena really quick?
There we go. That is correct. That is correct. Well, I'm sorry. Helena, I'm sorry.
Sorry. Unmute again, Helena. That was my fault.
Sorry.
Excuse me. There you go. There you go.
We go.
You got it now.
Okay. I'm so sorry. I really want the student voices to go first. I can totally wait until their questions are answered before I speak.
Okay. Well, let's go. So let's go to the questions in the chat, and then we'll go to Helena. Okay. So Heather in the chat said, so we can test in California and get an Oregon license if we are registered with OSBN?
Yes, it does not matter where you take the test. What matters is when you register for the test, what state do you want your test scores sent to? And again, you can only pick one.
Right. And then another question. So to reiterate, we can register now, but will not be released until the board releases us.
I would tell you to register when you fill your application, when you submit your application with us, because you could go ahead and submit the application before you graduate. That's fine. Not, a long time before, but, within a month or so before you graduate, you can go ahead and submit your application. What happens is the technician has to link up your registration with Pearson VUE and your application so that you don't get lost in the cracks. Okay. Because, we're only human. We can only, link up people that we have records for. So fill out your application, make sure the board has your application, then register for your test.
That sounds great. Thanks, Ruby. Helena, go ahead.
Thank you so much. I'm one of the associate professors at University of Portland, and I know many of my current senior students have already been offered positions. And hearing what you're saying about the difficulty in getting NCLEX registered, getting registered to take the NCLEX is really disheartening. Because all I'm thinking about is they are needed so badly in so many places. What am I really asking you?
I already know what you're asking me.
I thank you.
I get it. So
it's just a conundrum because.
So years ago, way before my time, Oregon did away with a temporary nursing permit. Like when I graduated back in the 80s, it took 9 weeks to get your results, and you worked as a graduate nurse until you got your results. Well, because the NCLEX is such a rapid turnover in terms of results, Oregon did away with the temporary nursing authorization. And we also found that many organizations didn't track how many GNs they had, and these GNs just kept on working past the date. So there's a flaw in that system. And I'm going to say this to the students, and I'm going to say it to the faculty. The board exists for public safety. It does not exist to get you employed, even though you're very much needed. The issue is this: the NCLEX is the validation that you have received an education that allows you to practice at entry-level nursing. When there is a shortage of preceptors, When there is a staffing crisis in organizations, even though you are badly needed, that is not the time for the board to be able to give you permission to work when you know you're going to show up and they're going to say, oh, we're 5 nurses down, you know what you're doing, go ahead and take a patient assignment, before you're ever even shown that you have entry-level competency. And a pandemic is not the time to do that. So the board is in a very difficult position of understanding where everybody is. Believe me, I was a director of nursing for many years, and staffing was the bane of my existence. But we cannot allow individuals to work as nurses unless they have proven that they have entry-level competency so that the public will stay safe. Again, if there was a overage of preceptors out there, if there was, you know, everything was wonderful and staffing wasn't an issue in our organizations, the board may consider something else, but they did consider having temporary permits, and they really said that is not in the public interest to do that. So I'm sorry, that's just kind of, the board does not exist for the nurses, the board exists for the public.
Right, thank you, Ruby. Does anybody have any other, if you have other questions about the licensing process, Kelly Illich, who's with the Oregon Center for Nursing, she's our operations manager, and she's going to be the manager of the chat today. She put a link in there if you wanted to get some quick information about the licensing process. And Jillian also put in the chat, I just want to confirm, if I wanted to work in California after I graduate, but I'm graduating in Oregon from UP in August, that I believe is going to assist us with licensure, can I register for licensure wherever, as long as the score is released to California?
Yes, it can only be released to one state at a time. So if you don't intend to work in Oregon, don't have your scores sent to Oregon. Have them sent to the state where you wish to license, regardless of where your education was.
Great. Thank you. Thank you, Ruby. Casey Shillum has her hand up, and I wanted to go to her because I also wanted to talk a little bit about the movement to an increased use of simulation education. So if you have other questions that are related to licensure as we're going through this discussion, and Casey's going to kind of probably talk a little bit about licensure, put your questions in the chat. Ruby's going to be with us for another 13 minutes. And again, Ruby is with the Oregon State Board of Nursing. She'll be with us for another 13 minutes or so. And then if there are any questions that come up that's related to regulation after Ruby has to leave, we can follow up with her individually. So
yes,
thank
please
you.
Do. Please ask your questions.
Yes. And thank you.
Hard time. And
thank you so much for being here today. I appreciate it.
Yeah, no problem.
Yeah, thank you.
Glad to be here.
Casey, let's go to Casey.
Thank you, because my question is still for Ruby, because I know we only have her for 13 minutes. And so Ruby, I'm hoping that you can just give a little bit of the background about what the board has done to support academic nursing this past year and a half, in the terms of the waivers that have been given and the continued partnership that the schools and the programs have had with the state board to ensure that our students are graduating with the competencies of our program, right, even if our students haven't met the number of hours that are expected. So I'm just hoping you could speak a little bit to that so everyone can have an understanding.
Yes. So the board listened a great deal to the programs. And as you know, the board has been given legislative authority to approve all the nursing programs in the state of Oregon that they are teaching to the entry level of practice and that their graduates can sit for the NCLEX. If the board does not approve your program, you are not authorized to sit for the NCLEX. You can get a degree, but you can't sit for the NCLEX. And you know, what's the point? And you can't sit in the NCLEX in any state if your organization, if your program in a state is not approved by that state board. Okay, so there are rules about how much simulation you have to have and how much direct clinical access you have to have. And those are rules that have been shown to turn out entry-level practitioners. Now, we know that you have been locked out. Your faculty has been locked out. Your faculty has been told no students on campus, no learning labs, no this, no this, no that. So what the board has said is that the programs can go to the electronic presentation of classes, electronic presentation of simulation, electronic presentation, until they feel such a time that they can get back into their clinical or get back into their facilities at their program. And the board has said it is up to your school to determine that you have met criteria for education. The board approves every program for certain things, and the board has waived those certain things for this COVID period only, and have stated to each faculty member and each dean or director, you and your faculty are responsible for making sure that whatever methodology you use, your students can be entry-level practitioners, which is really, in my mind, is the appropriate thing to do anyway. The board is not an educator, but you all know what it takes to turn out an entry-level student that can successfully meet the criteria of safe entry-level practice, pass that national nursing exam. Mm-hmm. So the board is also discussing about what we need to do now that it's winding down a little bit. But if you are graduated by your program, the board will allow you to sit for the NCLEX, even if you have never had a clinical practicum, because quite frankly, what you learn in clinical practicum, the tasks that people think are so important, none of that's in the Practice Act. Yeah. Communication, learning how to work with the interdisciplinary team, of course, that's in the Practice Act, but not when it comes to, how can I be a nurse if I can't start an IV? Well, that's not starting IVs is not the practice of nursing. So the other thing too is the reason we can hold your educators and your dean and your directors accountable is this is their practice. Mm-hmm. So if your dean decides to graduate you because woohoo, we can now graduate everybody, the board is counting on us, and we find that you are not practicing, or you have a concern saying, listen, I never even went to class for the last 6 months, not that anybody would do that, but just in case, we would open an investigation on your dean or your director or your faculty member, and they would be held as accountable to the Practice Act as any other nurse in this state. This is their nursing practice. They are practicing nurses. Therefore, they are held accountable to the Practice Act. So that's what the board has done. The board will continue to do that. We are not going to do anything until we get more feedback from the programs about how quickly we can undo some of this stuff. Yeah. And I also have a call out to get some CNOs together to talk about what about the emergency authorizations, because those can't be turned off either very quickly.
Exactly. So, Ruby, there's a question in the chat that said, with the waivers that have been in Oregon, does that apply to other states? So Oregon has made those waivers, but have other state made waivers that are similar?
I think all of them have made some kind of adjustments, but I can't tell you that. Every state has its own board, and every board makes its own decisions. I do know that, it's not like nursing education is that different in Oregon, or the COVID was that different in Oregon. I think a lot of programs have made these same adjustments, but you would have to contact the program or the Board of Nursing in that state if you wanted to know specifics about what they've done.
Great. Okay.
Thank you, Casey, for asking that question.
Thank you, Ruby. I know we've all been just so grateful for the support of the board throughout this entire experience. So,
well, we're grateful for you all that you have been able to continue the education of the students, and thank the students for hanging in there and trusting you that you will let them know what they need to know to be entry-level practitioners. And so it's a symbiotic thing.
It really is. This has been kind of an interesting year and a half of just like so many leaders have just been getting together, talking about all these issues all the time.
And who knows, we might change nursing education entirely because of what we learned with COVID.
And if we change it, it's going to get better.
Yeah, what I want to stress to the students is those IVs and those Foleys and those NG tubes and those things, that's not the practice of nursing. That's just stuff. Yeah. But your program will get you familiar with it, but you are by no means competent in
nursing.
Doing all of that when you get out of nursing school.
Great, thank you. So let me kind of pivot over into simulation, because I know that a lot of our nursing programs had to really rely heavily on simulation. And something that I've heard a lot is this concern that you might not necessarily be prepared because you haven't put in the Foley. You haven't had that experience in that direct patient care. You've been doing simulation instead. some of our practice partners that are here, I was wondering if it would be okay if I called on you to kind of talk about like, what's your expectation of the graduating class of 2021, who may have had so much simulation, so much more simulation than the class of 2019, and might feel like they have some worries that they don't have their skills up to snuff because they're not doing things the same way it's been done before. Melody at Kaiser. Melody Routley is here from Kaiser Permanente. Melody, can you kind of speak to just what your expectations are for the class of 2020 and the class of 2021?
Yes, for sure. I just want to echo what Ruby said, because I have said that repeatedly over and over and over again, pre-COVID, during COVID, and so on and so forth. So simulation is very valuable. We use simulation in our clinical settings because we can't always depend on our patients to provide all aspects of education for us or opportunities for education for us. So simulation fills that gap. So that we can practice those skills and we can practice those workflows, we can practice those critical thinking, we can practice all of that in a very safe, controlled environment. So simulation is amazing. I think that simulation has a very strong place in nursing education, and I'm glad that we were able to leverage simulation through our pandemic. In regards to what we're expecting from newly licensed or graduating nurses is really demonstrating your fundamental skills. Do you know how to care plan? Do you know how to write a care plan? Do you know how to collaborate with a multidisciplinary team? What about your communication skills? Can you connect with patients? Can you connect with your team? Do you know how to assign duties to CNAs or unlicensed personnel? Do you know how to do that? Because that's really what is important. We'll teach you how to use our skills. We'll teach you how to use the skills using our stuff, right? Mm-hmm. So that's all going to come during your transition to practice program or your orientation programs. So we're expecting those core fundamental professional nursing competencies to be solid and to be very articulate with us and very transparent and honest with some of the things that you might still be nervous about. Maybe you weren't in front of patients, but maybe you were in front of simulation actors, right? So just understanding the difference between that. So just being very honest, there's not really a lot of high expectations that you're going to be a proficient nurse right off the bat. You have to learn, you have to be in that novice phase. And, as you progress in your skill and your competence. So that's what we're expecting. Novice nurses with strong foundational nursing skills that they've learned in their schools and programs. That's what we're expecting.
Great. Thank you, Melody. Cindy Bianchini, who's from Legacy Health. There was a question, I was wondering if I could ask you the same question from a legacy perspective. What do you expect from the class of 2021? But I also wanted to recognize there was a note in the chat that said many new graduate applications are still asking how many hours and where they've gotten the hours by patient population. Mm-hmm. Probably right. Because those are not updated yet. And just because they are not updated, and Cindy, maybe you can speak to this. Is that necessarily going to be something that you're going to be, is that going to be a deciding factor on who you hire, understanding what everybody's just gone through?
Absolutely not. I mean, we understand what's happening right now, and it's happening universally, not just to certain schools. So yeah, it's probably a matter of it not being updated, and also a matter of it's good to know, even if you did do some hours somewhere, it's just kind of good to know, but it's definitely not going to impact a hiring decision. I couldn't agree more with what Melody said. I think she articulated that very well. Those core fundamental, the essence of nursing skills are really what we look for. We assume very little coming in. And this was even pre-COVID. We make no assumption that you knew much coming in. to begin with. So we have every intention of teaching you what you need to know in our residency program. We provide 18 weeks of orientation at Legacy, and that's a great amount of time to learn what you need to learn to be successful on your unit of hire. And we also provide a lot of classes in simulation on top of that. So just like Melody said, we don't have high expectations. We value simulation as a teaching strategy as well. And we understand what's happening right now.
Mm-hmm. Great, thank you very much. There's a couple of other questions about, Melody put in the chat, the number of hours doesn't reflect what was learned or patient experiences you may have had. And Tennille Gifford said, the problem is if they state no on the application, the TA doesn't route them to continue the process. You're right, this is new. And I think that there are a lot of systems that are not, when they have that kind of it's almost like the system that they had before isn't necessarily working and they haven't quite been able to change the system. But I think that I have not talked to an employer yet who has said that they are not understanding of what the situation has been as far as getting into online learning and using more simulation as opposed to clinical placement. I haven't talked to any of them yet. In fact, Ruby's going to jump off here in a minute, but the Board of Nursing months ago convened CNOs from hospitals all over the Portland area and asked them just straight up what their plans were. And a lot of them had adjusted their plans for their new grad orientation. They had opened up, like what Cindy was talking about with what their residency programs are. So there have been a lot of talk about how to accommodate this absolutely impossible and weird situation. And it's just something that we're trying to get through. Ruby also put in the chat that the Practice Act does not require a specific number of hours in specific population courses. It's an employer expectation that's not founded in regulation or in the evidence of what makes a successful practitioner or in any context of care. And yes, Tennille was continuing with, it's an automatic way to filter, needs to be removed from those applications. And these are conversations that are being started right now. Are there any other employers here? Anyone here from, I'm going to just look through the number of people here. Yeah, Ruby says to discuss new grad applications with HR. So yeah, that's something that we'll be reaching out to. Are there anybody else that's here from, I think that we had someone here from Asante, but I don't see her anymore. So she may have had to jump off. Any other questions that are related to just what your expectations are? Or do you have any other questions or concerns about the current situation that we have with new grads that you would like to share or you would like to talk about? Casey raised her hand and Holly unmuted herself. So we'll start with Casey and then we'll go to Holly. Go ahead, Casey.
Thank you so much.
And Casey, can you introduce yourself for the people that don't know you yet?
I will, yes. I'm Casey Shillum. I'm the Dean of the University of Portland School of Nursing. And I wasn't even thinking about introducing myself. I just really wanted to ask my question of Ruby when I first chimed in before she left us. So I would really like for us to think about, bye Ruby, thank you. I would really like for us to think about what is going to be happening with the students coming up, because we are graduating our senior class in August, but most of us also now have another senior class coming in this next academic year. And I'm really becoming very aware that we have made it through the crisis moment of the pandemic, but as a profession, I feel like we are on the cusp of another crisis. And this isn't going to be resolved easily. And this is going to be something we're going to be facing ongoing. And so I would love for us to just, to hear some thoughts. Holly, I would love to hear, I know that you and I are very like-minded on some of the challenges that we're facing, as well as Lois, but how can we engage with our students? And so I know we've got students here from so many programs right now. How can we engage with our students in a way that our students can become the ambassadors in the senior year, or those who are graduating? How can they become the ambassadors for the rest of the students in our state to help them understand where we are, why we're doing things the way that we are? And that, once again, I promise you, my nursing license is so important to me that I'm going to make sure all of my graduates are competent before I let them graduate. So I would just love to think about, how can we engage in partnership with the students who are in this next phase of being ready to graduate, and have them help with this message, to be these ambassadors, and to help us think about what are the best experiences we can create for them in a simulated environment that does prepare them for graduation and entry into new practice.
Holly, did you want to add on to that and tell us your thoughts?
Absolutely.
And Holly, introduce yourself, please.
Sure. So I'm Holly Caldwell. I am the Associate Dean of Nursing for Concordia St. Paul. Live here in Portland with everybody. So thank you. And, you know, Casey and I are always kind of that same mind that we want to take this and expand it. And, you know, what I'm thinking now is I really, really wish we had started town halls with students about a year ago, because I think that it would have helped everybody feel better. I know going to the huddles, the weekly huddles, for those of us that attended the COVID huddles, it became sort of like part therapy and also a good way to stay abreast of the issues. But we didn't really think about enlisting our students in this until now, because we are facing some things that we had hoped would resolve themselves, and they're not going to resolve themselves anytime soon. So we do need to work with our students to make sure that we are getting the word out, that you're well informed about what the issues are, and that you understand some of the confines that we're all working within right now, especially with critical shortages and preceptors. So, you know, as we're looking at how we can prepare you for that transition to practice, that's an area that I'm particularly interested in enlisting your help with, learning what has worked for you, because it is our licenses on the line. We do check that box to Ruby to say you're ready to sit for the NCLEX. And so we want to know what we've done that's worked, what we can improve upon, and how we can help you prepare these other students who are behind you, who have decided to come to nursing school during a pandemic and immediately after a pandemic, which is probably not the greatest time to go to nursing school. So how can we do this together, guys? What advice do you have? What questions do you have?
Well, there's some comments earlier about student charters, and I got to be honest, Tennille, this is the first I have heard of that. So please excuse my ignorance about that particular thing. And it looks like Helena Weiss from UP also did a big, the Zoom equivalent of a big thumbs up on that one. I think we do have a statewide nurses association, and Ali Wong is on that board this past year. Ali, if you are okay with speaking up, can you just put something in the chat, or just raise your hand? We can unmute you. But I'd like to hear about, with the statewide, the Student Nurses Association. Yeah, Sarah Torella also said that I think getting involved in the Student Nurses Association was the best decision I've made, because I was able to sit in the weekly huddles they had and hear information straight from the source. Other students can join those Student Nurses Associations going forward. Are you, all of the students that are here, are you familiar with your Student Nursing Association? Do you know who those representatives are and how to get in contact with them? There's only a couple of, Sarah's on the board of her Student Nurses Association. So we know, and Rachel Emery has her camera on and she is nodding. So the rest of you who do not have your camera on, so we got a yes in the chat, that's good. Okay, I just wanna make sure, if you don't know who is in your Student Nurses Association, or if you're not connected with that, check in with your dean, check in with your faculty and your professors, check in with everybody that you need to check in with and find out who those people are, because building the community is really the only way that we're going to get through this completely impossible situation. Kelly put in the chat a link to the Student Nurses Association. Tennille said the problem with the Student Nurses Association is very good, but different priorities. Students can be a very large and proactive voice for change needed for successful entry to practice. Yeah, and I agree. And I think that, yes, the Student Nurses Association might have different priorities. And if there needs to be if there needs to be a political level of change, then there does need to be a lot more connection and a lot more advocacy there. So thank you, Neil. What about your experiences as students? What have been your experiences that you feel like have either worked or just really have not worked over the last few months? How was doing the vaccine clinics for you guys? And the only reason why I asked that is because we had, okay, Sarah Terrell said she enjoyed the simulation at all the vaccine clinics. Thanks, Sarah. Yeah, I asked that because we did get a lot of people from the health authority that were always wondering how we can engage students even more with vaccine clinics. And every time we looked into it, students were doing it already. They were already there. So it's like trying to get students to engage more was not necessarily needed because they were already doing it. They were at the convention center. Melody Routley from Kaiser was really, and I think Cindy might have been, Legacy was a huge partner with that. Maybe not Cindy directly, but Legacy was a huge partner with the convention center in the Portland area. There was a lot of student involvement from all of the programs everywhere. So I'm glad Sarah enjoyed her vaccine clinic. I'm not sure if anybody else did, but Sarah did. Hannah said, as a student from the University of Portland, I'm wondering if all students will be able to be placed in an off-campus clinical setting. I know many students were unable to be in a hospital setting that year. It's possible that the answer to that is no. We don't know. And I think that that's the thing that's really frustrating. Like, we're living in this area of complete ambiguity. And maybe Cindy or Melody, maybe you could speak to this, or maybe some of the directors of the programs, you could speak to this too. Is it possible that they will not be able to get an off-campus clinical placement? Is that a possibility?
I can speak to that a little bit. Melody from Kaiser Ambulatory. Yes, I believe that there's going to be opportunities for clinical placements. However, there is a really big concern about overburdened RNs in those clinical settings. And so we need to be very careful and balanced. We want to make sure that students have an amazing clinical experience, a very safe clinical experience. And so we need to be able to do that, but we also need to make sure that the nurses that are working have the time that they need to be healthy and well and able to continue to in their practice. So just a really tricky balance. At Kaiser, there's no, we did have a moratorium on students. We had a national through all Kaiser National, all student placements were held for quite a bit of time. That was lifted. So it's basically a site-by-site decision. Mm-hmm. But if we're hiring a lot of folks, then our preceptors are going to be orienting our new hires and not able to precept our students. So it's just really tricky. So I guess the answer is, I don't believe that there's any global don't have students. I think it's going to have to be a unit by unit, a clinic by clinic type of situation where we have stable nursing teams that can really give a great clinical experience for students.
Great. And if I can just tag on to that, Melody, another thing that we've been hearing in some of the conversations we've been having with our employers is specifically that, they have to look at that unit makeup. If they've just onboarded 10 new people, maybe they have preceptors free, but they have to make sure that they have a stable unit that they're transferring people into. And so some employers are looking at having students have clinical experiences in units that they have not used before, which may not be in an acute setting. It may be more in the ambulatory setting within their health system. But they're trying to get creative, and they're having to take time to figure out what that looks like. And so that, again, leads to a delay. It's not a flat out no, They're still trying to figure it out.
Yeah, I can see that too. And just to I bring this up every now and again with the ambulatory setting, many of our RNs work remotely. And they started working remotely because of COVID, and we're keeping them remotely because it's successful. So we can't really have a student group in somebody's house. And so that adds another level of complexity, that we may have these amazing nurses that could be preceptors, but they don't have a location that can have students. So there's just a lot of complexity in student placements. It's not as straightforward as it should seem, or it should be, I guess.
Great, thank you, Melody.
And there was a question, Melody, specifically about Kaiser, and I know you have separate residency programs for your ambulatory services versus your acute services, but do you know if they're planning to run a transition to practice or a residency program for new grads in the near future?
So last week I was in new grad orientation all week. So we were able to do a small cohort. We're getting another small cohort together that'll probably start in mid-August. So we are trying to do things for new grad programs, our transition to practice programs. However, as of right now, it's been internal applicants, and so that doesn't help. It doesn't help the community, the larger community. But there is a huge amount of interest in our management group in the ambulatory setting to offer student positions. However, because it's financially challenging because of all of the COVID stuff that we've had to manage over the course of the last year and a half, we're using what we call a budget neutral process, meaning that we're converting budgeted positions into new grad positions. And so it takes a little bit of time to get those positions reposted for new grads. And so we're trying all these different options to open up opportunities for newly licensed RNs. And so as of now, we'll have had 7 over the next couple of months altogether. So for Kaiser, that's pretty normal. I know it's really small comparative to other organizations, but for Kaiser, it's a pretty large number for ambulatory. So Kelly, the answer is yes, we're trying to figure out how to have new grads.
Yeah, thank you. Cindy over at Legacy said, she put in the chat that her student situation at Legacy is really similar to what Melody is saying is happening over at Kaiser. But there was something that, Cindy, I was wondering if you could address. Sarah in the chat said, her peers are mostly worried that they are going to get into the field with very little patient contact. It will negatively impact their ability to be a competent nurse. She has relayed the statements about simulation being a valuable tool, and it hasn't really eased their anxiety, and she's not really how else to address their concerns. From your perspective as an employer, how do you feel about that?
I would agree that for the first time in a while, I heard that feedback from some of our new grads, from some of their preceptors about the discomfort interacting with patients. And that's not something I had heard much in the past. So that, I mean, we're not saying like half the cohort was experiencing that, but like 1 or 2, and I hadn't heard that before. So that is definitely something to consider. So I wonder about, when people ask me about going to nursing school, I always suggest getting their CNA license so they understand that, so they can practice those interactions with patients, because I think that is it can be a learned skill, especially for more introverted or shy individuals. So that is something that can be worked on in simulation. However, I think some role play and some simulated some difficult conversations or difficult patients simulations can be, that skill can be worked on definitely in simulation if they're not getting it at the hospital.
Yeah. Exactly. Thank you, Cindy. I appreciate that. Helena has her hand up from the University of Portland. Go ahead, Helena. Right, she's got to get unmuted. Let's unmute Helena's line. There you go.
Thank you so much. This is almost sort of a follow-up question to what I was asking. And Jenna, I so appreciate you and Ruby and everybody who has commented so far. How do I say this politically correctly? My observation from the many senior students that I have currently is that they are being offered jobs outside the state of Oregon because they can test and they can get hired immediately. And this, of course, being a native Oregonian, makes me like we're going to lose a lot of really strong, brilliant new grads. And I'm wondering, again, this kind of goes back to, you know, the governor. I understand the regulations. I feel like, as you mentioned at the very beginning of this talk, this cohort has really suffered so many blows and continue to do so. I can tell you firsthand, and I'm sure you've heard this many times before, the anxiety is off the charts. These students want to graduate and get out there and work. And it just feels like there's so many barriers that keep being put in front of them. And what am I really asking right now? I'm wondering, is there any way, like, I'm sorry, I feel my heart just breaks for this cohort in so many ways. And, you know, as an educator, like you said, I've been in education for almost 15 years and I can't even comment. I can't even comment on what this has been like. And again, I'm preaching to all the choirs right now. It's just just such a helpless feeling. I'm venting right now and I apologize, but it's just like,
yeah, it's understandable. And I do want to validate like the feeling that you have of frustration and hopelessness and just loss here. Because that has been an experience. I think that from your perspective as an educator, you have seen how it has been done. You've seen what's happened, and you don't have any kind of certainty about what's going to happen in the future. That does nothing good for your mental health. I promise you. And it does to engage and just like bring up a lot of anxiety. And that's kind of what I'm seeing. A lot of the comments in the chat is really reflecting that anxiety of, I think that this is how it was supposed to be done, but this is how it was done for me. And that didn't match up. And I don't know what's going to happen in the future. Totally understand that, totally understand that. And that feeling, I have heard that from so many people. It isn't just you. And it's a terrible frustration. And yeah, it's hard to articulate, but I really appreciate you sharing.
Thank you for listening.
Oh, you're welcome. It's totally fine. Casey has her hand up. Casey, where are you at? I'm trying to catch up on the chat too.
Well, I'm synthesizing in my head some of the comments that I'm hearing, and then also what Helena just spoke to. This is not a nursing education issue. This is a profession of nursing issue. And that's one of the reasons I am so grateful for the Oregon Center for Nursing, because this convening right now, well, the convening of the huddles for the last year and a half, it was therapy, it was problem solving, it was making things happen that needed to happen moment to moment. But it's also created this sense of community in our state for the profession of nursing. And now it is an opportune time for us to think about the workforce and the impact this is having. So when we think about the droves of nurses who are retiring, that we didn't plan on, it's also important to recognize that that's the expert pool of clinicians. And so now we have mid-career who are now the experts, even if they haven't been a nurse for 5 years. So it's a trickle-down effect all the way to our students' experiences right now, but it's an issue we have to solve together. And so I would love for us to continue this dialogue of, okay, what's the most urgent issue that we see right now? We see our students who are graduating are leaving the state. Okay, that's a problem. Let's figure out how do we retain them here. Now we have all of these amazing nurses who are now senior in their practice because everyone with, you know, who's 56, 57 has just retired. How do we support them in developing their leadership skill? And so it's multi-phased, and I know I'm talking really big here, but that's what we're going to have to do. And so we have to have the student voices being able to share with their classmates. We feel anxious, we know that, but they've got us. We're going to be okay.
Yeah.
And that's the message I want you to all hear, is that you are going to be okay.
Yeah.
You have the profession that wants you to succeed. We need you to succeed. And we're going to do everything we can to stand behind and hold you and help you be successful. So however you can think of us getting that message to your classmates, we'll do it. But have faith that we know that you're nervous. We know you're scared, but we've got you.
Yeah. And nursing is a tribe. You got into nursing school, you're in the tribe. So there are a lot of people out there who are rooting for your success. And everyone on this call is part of that. Melody has her hand up. Go ahead, Melody.
Oh, I just wanted to validate Helena also, because I think that you are feeling what I always feel every single time we have 50 plus applicants for one position.
Yeah.
Right. So I feel that before, I felt that during, I still feel that. It's like we just don't have enough positions to meet the needs in the greater Portland area. And it's challenging for nursing students that are graduating and trying to get into transition to practice programs when there's limited seats, but now there's even less seats because there's a variety of different reasons. One reason is just not enough preceptors. One reason is there's no money. There's just reason after reason after reason. And it's not fair. It's definitely not fair. But nursing is global, and you may not be able to get a position in the Portland metro area. Rural Portland needs you.
Rural Oregon.
Yeah, there we go. Rural Oregon needs you.
There are places in Oregon right now that are calling out the National Guard because they don't have enough nurses, but they're not in the Portland area.
Yeah.
So that is, it makes so much sense that you want to be in Portland. Of course, Portland's amazing. It's not going to be amazing Sunday. So everybody stay inside Sunday. But Portland is amazing, and we get it. But the whole state of Oregon is amazing. There's such an amazing group of people that live here, and there are openings in places that may not be in Oregon. This is a time for creativity, and creativity sometimes comes with anxiety and disappointment that you're not getting what you were expecting in the first place. But there are places, you're going to be okay. Emily put something in the chat, which now that we're getting about 3 minutes to the end of our hour, which I was going to tell everybody, would it be encouraged for nursing students to sit on the Friday huddles? Heck yeah, come to the Friday huddles. The Friday huddles are kind of open mic days. So really similar to what we've just experienced here. Bye, Cindy, thanks so much for coming. Earlier in the chat, Kelly put in a link to our Friday huddles. Our Friday huddles are every single Friday at 8 a.m. and they generally last for an hour, less if you have nothing to say. And so far, for a little while, we have not had nothing to say. We've had a lot to say. In fact, last huddle we had was actually the generation of this conversation, because we went over for the first time ever. And we're just talking about how concerned we are about the lack of preceptors, about the burnout of nurses, about the anxiety of nursing students, all of it. So these conversations are happening in a really, really big discussion. You are more than welcome to join. In fact, we need you there. And Holly or Casey, whoever said it earlier, you're right. You guys should have been there from the very beginning. And we were just completely overwhelmed with everything that was going on that nobody remembered to call you. But you're here now. So please come join us now. Be part of this nursing community, because there are so many things that are going to be changing. Remember, a lot of the problems that we have been experiencing, they were problems before COVID. They just got worse because of COVID. And so because they got worse because of COVID, it is up to this group of amazing people right here who have been through the fire to actually make it better. And I believe that we can all do that. So Kelly's putting in some chats about how you can stay connected to us. We need to be connected as a nursing community, and we need students to be a part of that. Join us on our huddles. Come and, in fact, I'm going to put, did I put this on here? Yes, I'm going to share my screen really quickly as we wrap this up. This is how you can get a hold of me directly. So if you would like to email me directly, this is my email address and my phone number. You can reach out to me. We can get you in contact with Kelly, who was on the call. Our research director, Rick, had a question or had something he was going to say and then took his hand down. So we'll hear from him later. But please stay engaged with us. And if there is more that we could do, if there is more engagement that you need or other ways that we can connect you with your peers across the state, we are so into that. We want that so bad. So please let us know what you think. Let us know what you're thinking, how this is all working out for you, because we are committed. Oregon is going to have the best nurses in the entire United States. We are. We already do.